Now let's talk to Dr. Layla McCay, who's director at the NHS Confederation. Good morning to you, Layla.
Good morning.
Let's first of all just talk just briefly, we can, about the advice on face coverings. We're now told that we should have face coverings when we are in in enclosed public spaces. You don't need them when you're outdoors, but you do need them if you're going to be going into a shop or if you're on public transport. Government has repeatedly said that they don't think there's very strong medical advice for these, and that they're more about protecting, perhaps on a very small level, other people rather than protecting yourself. But do you at the NHS Confederation, do you agree with that advice?
I think that the most important thing for the NHS is that we have enough PPE for the health professionals and the care professionals who need that PPE. So whether people are wearing masks or not, I think that really what our big focus is, keep the health grade masks for the health professionals, because we don't want to get ourselves into a situation where there's competition between the health professionals and the general public, when we know that the benefit for people like health professionals who are working so extremely closely with people who have the infection, who are conducting procedures that put them at extra risk, they need to know that they're going to have the protection that they need. Yeah. So while it's fine that everybody might be, while it's fine that everybody can be wearing some kind of face covering, that shouldn't be in competition with the NHS.
No, you're walking along the street in broad sunshine, metres away from other people wearing sort of a medical grade face mask is really not necessary, and you're probably taking it away from someone else who needs it far more than you. Let's talk though about the people who are now most likely to die. We know there's big concern about what's going on in care homes. We're going to talk about that a little bit later in the show. Still, we're looking at really mass outbreaks of the virus in care homes, but also a new report from looking at the statistics from the Office for National Statistics showing that it's people in low-paid manual jobs facing a much greater risk of dying through coronavirus than those who are white-collar and higher paid. Men in low-skilled jobs are 4 times more likely to die from the virus than men in professional occupations. Women who work as carers twice as likely as those who work in professional jobs. Now, this has probably got very little to do with the amount people are paid. It's all valued. A discussion we had a little bit earlier in the show. This is about people getting into contact with the virus, or perhaps a lot of things about the other aspects of their life. But is this a big concern at the NHS Confederation?
I think that it's an incredibly big concern. What the coronavirus pandemic is showing us is what we've understood in all sorts of different contexts, which is that there are incredible inequalities in health across the UK. Some people are more likely to be in better health than others. There's differences in what age you're more likely to die depending on where you live, different factors around how much money you have, race bringing into a part of this. There's all sorts of different things that affect your risk of health problems, and I think that we're really looking closely at this as a result of coronavirus, and hopefully the insight that we're getting here will be able to be expanded out for us to have a really better understanding of what's going on more widely and what we actually do about this, so that everybody has a much fairer opportunity when it comes to health.
Yeah, well, again, a lot of it's down to the choices people make themselves in their own lives, isn't it? In terms of what can be done to make sure that we are going to be safer as we go back to work, children go back to school, and normal life of some kind resumes. The wearing of the face coverings is a small aspect of that. A lot of this, obviously, the social distancing. But the testing, is that still a very big concern? We know there's still some shortages of PPE, but the testing and the ability to track and trace and test people and actually make sure we know who does and who does not have the disease, is that going to be absolutely vital? And are you sure that the government is now on top of that?
It is absolutely vital that we crack the test and trace and isolate plan. And I think it's quite clear that has not yet been cracked. There are many challenges. We are hearing from members in all the different health and care sectors that there are still challenges in them getting access to the testing that they need. And that's just healthcare staff when we start looking at people out in the community. There are all sorts of complexities as to how they get access to the testing that they need. And what we're seeing is that as we're scaling this up more and more, we're really needing to strengthen the infrastructure behind that. And what we're hearing from our members in the NHS is that that needs to be a collaboration between the national and also the local expertise to really be able to make that happen across the whole country.
Thank you very much indeed for joining us, Dr. Layla McCay.